Hi everyone, welcome back to my channel. My name is Masindra Brani and I'm a physiotherapist. Currently, I am employed in the government hospital and I'm just here to tell you all the experiences that I've been having and also how to help you navigate when you come to the hospital, or how to ease your anxiety, or how to calm you down if that's going to be possible. Last but not least, I'm going to be giving out a lot of healthcare advices, especially when it comes to your physical health, your mobility, and a little bit of like everything, just to ensure a healthy lifestyle and longevity so that you don't end up in the hospital, which is where I work. So, one of the things I do not like the most in my life is complaining. I don't like people who complain. I do not like just always voicing out your complaints. Like, I like people who communicate well and I like people who ask questions. So one of the main complaints when it comes to the public healthcare center is that the patients complain that they wait long, that they were up at 4 a.m. in the morning and they're only being seen now at like 2 o'clock in the afternoon. So the purpose of this video is to explain why it takes long for you to be seen. So in the hospital, there's people already admitted in the hospital. That means that they are critically ill, that they needed the hospital admission. So it means that that patient is not doing well and they have to be prioritized out of everyone else who needs the healthcare attention. So when you come as a patient who is coming for as an outpatient, which means you're coming for a day to seek medical, to be seen by the doctor or the physio or the OT or the speech therapist, or you're coming to a wound clinic, it means that you are coming from home. It already means that you still have a chance. It means that you might be injured or you're not well, but you're not critically ill that you need to be seen by the hospital to be admitted. So everyone else who's admitted, everyone else, the staff I just talked about, the doctors, the physios, the OT, all of us are obligated to start in the wards and make sure that we see those patients first. They are stabilized. No one is going to need a resus and we're going to need to resus. No one is going to end up being discharged and they're not given crutches, or they're not sent to the local clinic, or they're not given the sick note that they want, or they are not given the medication that they want. So in the morning, our main priority is to go to the wards, quickly see those patients, make sure everything is all right. Then we go back up into the clinics that are running and then we see everyone else. So this is why you will wake up at 4 to be in the line, but the line will only start moving somewhere around 11 or 12. And you're going to end up being seen around 2 o'clock or 3 o'clock. Unfortunately, because the healthcare system is very burdened and overstretched to cover almost the whole of South African population with the resources that they have, we don't always have people that are stationed in the clinics just waiting for you guys. It's the same staff that needs to treat the people on the inside that actually still needs to see the people that are coming on the outside. So with that small little later fat chat I just had with you guys is that be patient when you come to the hospital. So you will still need to wake up at 4 because there's still going to be other 500 people in the line with you. So you still need to come early so that you can be maybe number 100 in the line, number 50, or the first person on the line. And then you are seen around that 11 o'clock or 12, and then you go to the pharmacy and then you go home early. So you still need to come early to procure your space, but just know that the people that are critically ill are seen first in the wards, and the very same people you are waiting for, the doctors, then will come from the ward and see you. And then when you're done, you can go home and continue the treatment that you've been given. Right. So then you do not need to complain. You do not need to fight. You do not need to be angry. You just need to be more understanding that the resources you're waiting for are very limited. Thank you for listening. Kindly like, subscribe, and keep watching all the beautiful things in this channel, on this channel.